Hey all, Dr. Sepperwall here. Today we're going to be talking about car seat positioning and how it can help reduce your neck, lower back, and sciatic pain. Okay, first things first, let's talk about car seat angle. What you want to do is, usually with a lot of people driving in their car seats, it's always an angle that's less than 90 degrees. What we want is an angle that's more than 90 degrees. The reason why we do that is to take physical pressure off your discs, your joints, and your nerves in the lower back. When you have a curve or angle that's less than that, you're loading that disc and putting maximal pressure on it, and we do not want that. So how are we going to achieve this angle? So it depends on your car. A lot of the cars that are made today, they allow you to have electronic controls where you can control the angle of the vertical cushion and horizontal cushion. So let's talk about the electronic ones first. If you look over, I guess we have to view out. There you go. You can see controls over there. They kind of look like that in many cars, like so. But you can come back to me now. Hello, remember me? So that allows us to move the horizontal cushion up and down, right? Now we want to move it vertically as well. So again, what we want is more than 90 degrees. Okay, so first let's do the horizontal cushion. You're going to bring it down a little bit, just so that much. The good thing about this is not only does it take pressure off your lower back, but it takes a lot of pressure off your hamstrings, because if it's a high or if it's like a lower kind of angle, this is going to put increased pressure on your hamstrings. If you're dealing with sciatica, you definitely do not want to feel that. Okay, so after that, obviously we're going to work on the vertical angle, and what you want to do is just bring it back a little bit. Now of course, as you do bring it back, you will be further away from the steering wheel, so obviously common sense, we are going to move the whole seat forward as well. Okay, and then lastly, what you want to do is you want to use the lumbar support. A lot of those electronic car seat controls also allow you to puff out the lumbar support in your in the vertical cushion of the seat as well, just to give that kind of curve in your lower back. If we can keep that curve in the lower back, it's going to take maximum pressure off of your discs. So let's demonstrate how we're going to do this with the electronic seat. Okay, first of all, I'm in a horrible position. It's a chiropractic nightmare basically. Okay, so what's happening here is you can see my angle. I'm basically squeezed in. I can already feel the pressure on my discs already. So what I want to do first is I want to work on the horizontal cushion. Okay, so what I'm going to do is I'm going to twist it like so. You can see how it changes, and it's taking pressure off of my lower back and also off of my hamstrings. Next, let's work on the vertical aspect and bring it back a little bit. Of course, now you're a little bit further. If you need to, you can move your seat forward too, just so you're not too far away from everything that you need, right? And then lastly, what we want is, there we go. And lastly, what we need is to put that lumbar support in as well. And as we do that, it also brings your back back to its proper curve as well, right? And one more thing, if we're talking about neck and shoulders, is a lot of people will drive like this. That causes a lot of tension like so. So what you want is if your shoulders are relaxed like so, this is where you need to be. It's the same thing with typing in the office, right? Nobody wants to be typing like this. At the same time, nobody wants to be driving like this. So rest your arms down. If you can sit like this with your shoulders resting properly, then that's where you want to be, right? And if that means raising your seat up or down a little bit more, then do that. Okay, so what do we do for people who don't have the electronic option of both the, vertical and horizontal cushion? There's ways around that as well. So what we're going to do, of course, is, again, we're raising that angle. If you have your angle less than 90 degrees, we need to combat that. First, what we're going to do is we're going to increase by bringing that vertical cushion back, right? And next, to combat this, you can use a memory foam pillow or any kind of pillow, actually. Even that crappy pillow that us chiropractors don't want you using for your neck, now it has some purpose. If you take a flat pillow from home, you fold it up and you just place it right here in the most hollow part of the horizontal cushion. You can do that, and that can help lift you up and kind of give you that same kind of effect as increasing the cushion angle by making it a little bit more vertical. Just put that pillow in there as well. Don't forget to squish it and fold it. And then you're good to go.